Hi, I'm Dr. Ashley Mack of Ashley Mack Performance and Rehab, and today I'm going to tell you about working on knee extension to help you out when it comes to knee pain or knee aches. Now, we spend the majority of our days sitting down, and so with that being the case, our knee doesn't have that many opportunities to get straightened out. Now, the purpose of today's movement or exercise is not necessarily to strengthen our quads, because our quads are actually really strong to begin with. What we're really trying to do is implement what is called a neurological stimulus to just get the joint moving and making it feel better. So this is something that you can do at the office, on the couch, anywhere, because it requires no equipment and you're not in a super awkward position. So you're going to assume the sitting position, and your goal with this is to sit upright. Now, for some of you, if you have really tight hamstrings, this is already going to be a challenging position. So if you are unable to sit like this, it's okay to round forward just a little bit. Once you establish your position, the next step is actually going to be pointing your toe up towards the ceiling, kind of activating the front aspect of your shin. There's some studies show that when you point your toe up towards the ceiling, your quads activate a little bit more through what is called irradiation. So once you assume that position, you assume that toe up position, the next step is actually to secure yourself and kick your legs straight as much as you can. Again, if your hamstrings are really tight, it's okay to bend forward just a little bit. If your hamstrings are okay, it's important to actually keep your torso upright. You're gonna kick, no need to hold, bring your leg back down, kick it up towards the ceiling again, and you're gonna go for about a set of 10. 10 repetitions is really just more so an arbitrary number, so if it only takes you about 5 repetitions to feel better, that's perfectly fine. If it takes 10, 15, 20 repetitions, that's no problem whatsoever. And knees are sometimes really hard to treat. In some cases, they benefit really well from something like this, as simple as this knee extension exercise. In some cases, they require a little bit more of an in-depth assessment. And today, if you try this out and it doesn't really help, it's really not the end of the world. But if that's the case, I encourage you to actually click on the link below and book a consultation call with me.